Action.
Okay, so you log into the PowerChart with your username and password. Once in the PowerChart, you need to do your staff assignment, which will be done by the charge, but we need to know it as well. Can you pause it?
2.
Okay, so first you have to set the proper shift. So it's today, April 29, 7:30 a.m. to 7:30 p.m. Then your shift location, which will be shown here, and you add a care provider using this icon, or you right-click on this area, gray area, and click on Add Care Providers. So for Okay, so just for the purpose of example, we'll search for an RT. Okay, you get your name, and click and drag to assign care providers box, and just click on OK. So there's one respiratory therapist assigned. Then we will have to assign patients to the RT. Okay, by doing this, we'll have to select your location. For example, I'll take CCU. You'll have to drag the head of this patient to this one, the RT's name. That's it. So you have one patient under the respiratory therapist. And don't forget to click on Save and refresh. To access your patient list, you'll have to click here, Patient List, and I'll have to delete this first to show you an empty one. Okay, click on the wrench icon, or the list maintenance icon. Open this one. I'll have to delete this first. So you'll have to make a new list. Click on location, and you'll have to look for the location here where you are assigned. For example, KKUH, ICU building, and example, you're in CCU, so just click on CCU. You can change whatever name you want to put here. For example, my name. Then click on Next and Finish. And then you move your list to the active list box and click on OK. So this is my list. These are the patients in the CCU. Okay, but for example, I only assign one patient for me. Okay, don't forget to refresh here. Refresh is here.
5.
To open a patient's file, you go to your list, and then you just, for example, I'm taking ICU 8, just double click to open. This will be the blue file of the patient. Okay, so to check for new orders or verify new orders, you go on this orders, and you check, for example, there's an order for a new nebulization, salbutamol. You check on the, you click on the orders, and these are the new orders for the patient, all orders. You go on medications for nebulization. In case there are orders for CPT, intensive spirometry, there will be a different section here. It's called respiratory, specified for us. Okay, so here it's ordered, salbutamol is ordered. Okay, so the job status here, it will show if the patient, if the order is ordered, canceled, or discontinued. Okay, so you always refresh. Do not forget to refresh. Okay, so if you don't refresh and there are new orders, all those new orders will not appear on the screen, will not appear on the file. So you have to refresh to avoid stacking up of orders. Okay, if you need to sign a medication after you give your neb and you need to sign a medication, for example, this one, you need to go to the Medication Administration Wizard, or the MAW. You click on the MAW. So you'll have to scan the patient's wristband, but since we don't have the wristband, so just click next. Yes. Okay, refresh again. That salbutamol order will be here. Here. Salbutamol, this is the one on the order. Just click on the box, check, and just yes, because we don't have the wristband. Right click, and chart details. If it's given, not given or not, it should be witnessed by the RN, bedside RN. So for example, I just use a chest RN. I'm going to sign for one RN. Okay. So if it's given, just click on OK, and there will be a pop-up here that will require the signature of the nurse. So you just let her type her signature. If it's not given, you just click on Not Given. You should provide a reason. So you choose a reason, for example, tachypnea. And then click on OK. Then the nurse will provide her password. If not, you can cancel. So for example, it's given. It's given here. OK. I'll type in the password. Okay. It's done. Lastly, you click on sign. If you click on sign, it means the neb or the medication is given already. So you can check in the Medication Administration Record or the MAR if it's given. So it's here. Salbutamol. This should appear. Verified. Verified should appear to know that the medication is given. If in case you need to modify, for example, you charted but the nurse was not able to countersign or witness, you can just right click here and then click on modify. Then this will appear. So you can ask the nurse to witness the medication for you. And then once it's modified, you just click on the check sign above to modify the charting. Okay, but since I'm not going to modify anything, just cancel. Yes. To document the RT progress notes, you click on Interactive View on the I&O. This will automatically take you to the respiratory therapy side of the iView. Okay, so here you can just click on the specific portion of the chart where you want to chart. For example, if you're on MECVEN, so here, if you're on BiPAP, here, aerosol therapy. So I'm going to chart since we gave aerosol therapy. Okay, since we chart also breath sounds, so it's here, breath sounds, cough and suctioning is here, everything is here. So example, only anterior and let's say wheezes and cough, instructed cough, spontaneous cough, yes. Cough is strong, sputum amount, scan, clear, and 10. So if you're done charting, you just click on the check sign here, check mark. Then it's done. If it's in black, it means it's charted already. If it's in purple, it means it's not yet signed. So if you need to modify anything, for example, you made a mistake in the breath sounds, you just hover on the cell, right click, and click on modify. For example, it was coarse crackles. And if you're done, you just click on the check sign again. An icon here, the small triangle, will show that the charting is modified, but it's still final. For example, we're going to do ventilator monitoring. For example, it's initial hooking to the ventilator. So just initiate. So if you want to put the model, it's fine. For example, 840 is on Alcor. Mode, AC, breath type, VC, ventilator frequency, example 10, tidal volume. You're right here in liters. So example 350. Okay, 350 ml. So if this one is here, it means it's automatically calculated for you. Okay, so P5, we're not in CPAP, we're not in PS. FiO2, 100. Okay, so this is the measured or the monitored. So example 16. You have to double click on the cell so you can say 5. So it will be automatic. Okay, so it's 5, and then exhale. Let's say 300, of course. Peak inspiratory pressure. So 1, pressure 2, 12. Okay, so example, Scalars already, you filled up everything. You just click on the sign, the check mark, and it means it's charted. So if we're gonna, for example, initiate an oxygen therapy, so it's here, O2 therapy or titration, you can, for example, initiate, then just fill it up. Example in the ICU is continuous. Flow rate of sample 2. Oxygen therapy, use your nasal cannula. Click on the X mark. Humidification, if it's cool, warm, so we use cool, and So if we need to titrate, just a yes. Sample we decrease to 1 liter. And so we just have to choose which oxygen delivery device you're using. Improved oxygenation. If there's no untoward symptoms, then you just click on check and it's charging. Okay, if we need to document blood gas results, it's here, blood gas. So it's divided into arterial or venous. For example, pH 7.45, CO2 of 43, and just click on the check sign if you're done.